Hi, my name is Sarah Tucker. I'm going to be your nurse today. This is Daisy Tucker. She's a 17-year-old female. Do I have your consent to do an abdominal assessment on you today?
Yes.
Okay. We're going to begin with inspection of your abdomen. What I'm going to be looking for is to make sure that it's contour. It is nice and flat. Skin assessment on it. Everything appears smooth, even skin tone. The umbilicus is midline. It's not reddened or inflamed at all. It's symmetrical. Can you do a sit-up for me without using your hands? Just going to assess for muscle symmetry. Okay, everything looks really good with that. Okay, and then the last thing I'm going to do in the inspection is look for the aortic pulse, which will be just midline between the xiphoid process and the umbilicus. And I am able to see a pulsation there. The next step in the assessment is going to be an auscultation assessment. I'm going to be listening to bowel sounds, which are high-pitched gurgling noises that occur 5 to 30 times a minute, depending on how recently you've eaten. There's no need to listen in all 4 quadrants because sounds radiate from one quadrant to the other. So what I hear over here might actually be happening in another quadrant. The important thing to note is their presence, whether they're active or not, and the actual level of activity, whether they're hypoactive or hyperactive, which could give signify blockages or obstructions, things like that. So I'm going to go ahead and take a listen, okay? I did hear them immediately upon auscultation. If I had not, I would have listened for at least 5 minutes before I determined that they were completely absent. The next thing I'm going to listen for are vascular sounds. I'm going to listen to your aorta, which is midline here, and then lower into the iliac arteries that branch off of it. What I'm going to be listening for are bruits, which would be a whooshing sound, which would signify a blockage or stenosis or obstruction of the vessel. All right, very good. No bruits were heard in either the aorta or the iliac arteries. All done with the auscultation part of the assessment. Going to move on to the percussion part. This is where I'm going to use my fingers to assess the organs that lie behind where I'm actually tapping on my knuckle, listening for sounds, changes in the sound. So we're going to start with a general. I'm going to start in the right lower quadrant, just going to go all around the abdomen to just kind of get a sense of what I'm hearing. Most of what I hear is going to be a higher pitched tympanic sound because of the presence of air in most of the abdomen with the intestines and the stomach. And that is in fact what I heard. The next thing that I'm going to percuss is going to be the liver, located in the right upper quadrant. The way to assess this is to start at the midclavicular line, moving your way down until the percussion sound changes from a high-pitched tympanic to a lower dull sound. When you get to that point, I'm going to mark where I'm at. Then I'll move from the bottom lower intestinal area up to the sound changes to that low dull sound again. I'll measure between those 2 marks, and that will be the margins of the liver. So we're going to go mid-clavicular, which is going to be right about here. Okay. measure, see where we're at. Normal average for an adult is anywhere between 6 to 12 centimeters. For females, the average ranges about 7 centimeters. It looks like Miss Tucker's is about 5.5. She is only 17, so I would say that would be fairly normal. She's maybe not done growing yet. The next thing that I'm going to percuss is going to be the spleen, which is over here in the left upper quadrant. I'm going to go to the 9th to 10th intercostal space at the anterior axillary line, which is going to put me about right here, percussing. It should be the dull sound as well, which would signify that I'm over a solid organ, which I did here. The next organs that we're going to listen to and assess with percussion are going to be your kidneys. I help you to sit up. Cross your legs so you can sit up nice and straight. I'm going to place my hand over on her flank area at about the 12th rib, which is going to be about right here. I'm going to use my other hand to gently thump it on both sides. Ms. Tucker, did you feel any pain with either of those? No. Okay. If any pain was felt, go ahead and lay back. If any pain was felt, that would have been a sign that there was some inflammation to the kidneys. The next thing as far as percussion that we're going to look at is called the fluid wave test. This assesses for the presence of ascites. If I can get you to take your hand, set it right there, hold it midline. I'll place my left hand on her right flank. Using my right hand on her left flank, I'm going to gently tap it. If I were to feel any thump or any wave in my left hand, which I do not, that would be a sign of ascites. So everything looks good there. All right, onto the palpation part of the assessment. This is where I'm going to use my fingers. I'm going to press throughout your abdomen, trying to assess your organs by feel. I'm going to start out with a light palpation across your entire abdomen. This will just give me a good idea of your anatomy. Also assess for any pain with gentle palpation, okay? Just try to stay as relaxed as possible. Don't tense up or get real stiff or rigid. I'm going to press down about 1 centimeter with my fingertips, moving throughout the abdomen clockwise direction, starting in the right lower quadrant. Push my fingers in and gently roll across the skin, moving the skin with me.